Losartan is an angiotensin receptor blocker used to treat hypertension and diabetic nephropathy, and is used to reduce the risk of stroke. In this video, let's find found. What is Losartan? What is Losartan used for? Contraindication. What are the side effects of taking Losartan? How does Losartan work? How to use Losartan? What is Losartan? Losartan, sold under the brand name Cozaar among others, is a medication used to treat high blood pressure, hypertension. It is in the angiotensin receptor blocker, ARB, family of medication, and is considered protective of the kidneys. Besides hypertension, it is also used in diabetic kidney disease, heart failure, and left ventricular enlargement. Losartan was patented in 1986, and approved for medical use in the United States in 1995. It is on the World Health Organization's list of essential medicines. It is available as a generic medication. In 2020, it was the 9th most commonly prescribed medication in the United States, with more than 54 million prescriptions. What is Losartan used for? Losartan is indicated to treat hypertension in patients older than 6 years, reduce the risk of stroke in patients with hypertension and left ventricular hypertrophy, though this benefit may not extend to patients with African heritage, and to treat diabetic nephropathy with elevated serum creatinine and proteinuria in patients with type 2 diabetes and hypertension. Losartan with hydrochlorothiazide is indicated to treat hypertension and to reduce the risk of stroke in patients with hypertension and left ventricular hypertrophy, though this benefit may not extend to patients with African heritage. Contraindication. Losartan is contraindicated in the following patients: hypersensitivity to drug/class/component. Caution if renal artery stenosis, renal impairment or hepatic impairment. Side effects. Losartan use can result in cold or flu symptoms such as stuffy nose, sneezing, sore throat, fever, dry cough, muscle cramps, pain in your legs or back, stomach pain, diarrhea, headache, dizziness, tired feeling, or sleep problems, insomnia. Pharmacodynamic. Losartan is an angiotensin II receptor blocker used to treat hypertension, diabetic nephropathy, and to reduce the risk of stroke. Losartan has a long duration of action as it is given once daily. Patients taking Losartan should be regularly monitored for hypotension, renal function, and potassium levels. Mechanism of action. Losartan reversibly and competitively prevents angiotensin II binding to the AT1 receptor in tissues like vascular smooth muscle and the adrenal gland. Losartan and its active metabolite bind the AT1 receptor with 1,000 times more affinity than they bind to the AT2 receptor. The active metabolite of Losartan is 10 to 40 times more potent by weight than unmetabolized Losartan as an inhibitor of AT1 and is a non-competitive inhibitor. Losartan's prevention of angiotensin II binding causes vascular smooth muscle relaxation, lowering blood pressure. Angiotensin II would otherwise bind to the AT1 receptor and induce vasoconstriction, raising blood pressure. Half-life. The terminal elimination half-life of Losartan is 1.5 to 2.5 hours, while the active metabolite has a half-life of 6 to 9 hours. Dose. The dose of this medicine will be different for different patients. Hypertension. 50 mg per day initially, may increase to up to 100 mg per day. Patients with possible intravascular depletion or receiving diuretics, for example, on diuretic therapy, 25 mg per day initially. Hypertension with left ventricular hypertrophy. Indicated to reduce risk of stroke in patients with hypertension and left ventricular hypertrophy, but there is evidence that this benefit does not apply to Black patients. 50 mg per day initially, may increase to up to 100 mg per day. Hydrochlorothiazide 12.5 mg per day may be added in combination, may increase to up to 25 mg per day. Nephropathy in type 2 diabetes. Indicated for diabetic nephropathy with an elevated serum creatinine and proteinuria, urinary albumin to creatinine ratio greater than or equal to 300 mg per g, in patients with type 2 diabetes and a history of hypertension. 50 mg per day initially, may increase to up to 100 mg per day. Safety advice. Losartan is not recommended in pregnancy. It can reduce the level of fluid around your baby, particularly if you take it in the second and third trimesters of pregnancy. This can result in long-term damage to your baby's kidneys and lungs and a number of other problems. That's all the information about Losartan we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.